In this last section of managing teams and conflict management, we want to look at restoring and maintaining trust in teams or preventing conflict in the first place. Research has shown that workplaces with the following characteristics maximize outcomes for clients, nurses, and organizations. The Joint Position Statement of the CNA in 2015 describes quality practice environments as ones where nurses experience respect and are involved in decision-making. Quality practice environments promote effective and transparent communication at the individual, organization, and systems level. They also help nurses fulfill their professional, legal, legislative, and collective agreement requirements and ensure they can participate in decision-making that affects their work. Quality practice environments also support safe and realistic workplaces. Workload is the top issue for Canadian nurses today and is often cited as a key factor in turnover, which we've already discussed. Effective leadership is important in all nursing roles and is an essential element of quality practice environments. Quality practice environments also include technologies that support critical thinking, enable the provision of safe and effective care, and provide opportunities for information and knowledge management. Nurses who are adequately supported and funded to allow for access to professional development opportunities are also engaged in quality practice environments. And a quality practice environment also creates a workplace culture that values the well-being of clients and employees. So why is a professional practice environment so important to nurses? Well, the research indicates that nurses need to work in contexts where cooperative values are supported to engage in constructive conflict management practices and to optimize employee health and work functioning. Professional practice environments in which nurses are involved in hospital decision-making, where there is a nursing model of care that guides practice, where leadership is supportive of nurses, and where collaboration between nurses and physicians is active, creates a work context that values mutual goals and conflict is resolved. The studies suggest that nurses who perceive themselves to work in such environments are also more likely to report effective conflict management approaches on their units that are characterized by open communication, collaborative problem solving, and reciprocal resource exchange, can create positive team environments. So setting the stage for constructive conflict resolution and unit effectiveness suggests a fair and respectful treatment of others, a mutual recognition of being in a shared community, and a willingness as a team to collaborate towards goals. Nursing leaders can change the climate in the workplace and promote better collaboration among workers by interrupting a group's dysfunctional behavior patterns. Leaders can also influence change by shifting their own behavior patterns and the habitual responses that may be contributing to conflict. Those who leverage personal change can have a significant influence on group dynamics because their actions and decisions are highly visible, particularly during a crisis. And as group members watch how the leader handles the situation, they can learn and adopt practices that can become the norm across the workplace. So creating connection with others, particularly in the team, when a conflict arises, can be addressed by de-escalating a situation, noticing and acknowledging the emotional state of others. Try to elicit insight by revealing other concerns, wants, or needs, and build trust as a foundation for problem solving, and clarify what's possible and realistic to move forward. In the College of Nurses of Ontario Professional Standards on Conflict Resolution and Management, they highlight an nurse leaders' responsibility in preventing conflict. When nurses in formal leadership positions actively promote behaviors that prevent the escalation of conflict, nurses see the value of conflict management firsthand. Nurses in formal leadership positions can make conflict resolution a priority among all staff members. They can empower staff members to resolve problems among colleagues and provide nurses with greater autonomy by participating in decision-making and opportunities for professional development. Nurse leaders can foster positive relationships, trust and respect among staff members, and promote a work environment in which conflict-creating forms of behavior, for example, exclusion or dysfunctional cliques, are not tolerated. Nurse leaders recognize the factors that contribute to conflict and promptly intervene to diffuse conflict situations before they escalate. They help staff members to develop conflict management interventions, recognizing that change can precipitate conflict, and implement management strategies that encourage positive attitudes towards change, and seek learning opportunities to increase the comfort level of staff members in dealing with conflict resolution. This word cloud accurately describes the multifaceted aspects of your role as a nurse leader. Cloak and Goldsmith's quote here under resolving conflicts: change the way you think about disagreements and how you behave during conflict. Be willing to listen, engage directly, constructively, and collaboratively with your colleagues. Trust is a reaction to authenticity, and authenticity is a synonym for trustworthiness. Trust is built on past experiences, and trust is dignity in honoring the presence of others, including the feelings, thoughts, and expertise that they bring. Building trust could be seen as 4 R's. R for real self. Saying what you mean, doing what you say, owning what you do. Respect. How someone behaves, how they talk to other people. Do they say one thing and do another? Relationships. Engaging with staff on a personal level and having a willingness to listen. An R for risk-taking. Encouraging risk-taking and supporting things if they go wrong, knowing you can be dependable. Another acronym that's been used in addressing building trust is SHARE. S for share the vision and values. H, asking how I can help you. How are you? The key here is really knowing your people, understanding their strengths and challenges. A for authenticity. R for role modeling and being consistent. And E for engaging for change and seeking input, keeping the door open and lending an ear. Stephen Covey points out that trust is the currency of leadership. When trust is high, things go well, but when trust is low, things can have a cost. Trust builds over time and happens when the staff sees consistent behavior which reinforces that the leader can be trusted. So how do you build trust in your leadership? First of all, keep your commitments. This is the most significant behavior you can demonstrate. It's the quickest way to build trust in any relationship. Extending trust and empowering others. This way you can leverage your own leadership, and you should always have a bias, a desire, an inclination to trust people. Show a commitment to your own work. Commitment towards a clear purpose is the primary driver of leadership trust. Nurses pay more attention to what their leaders do versus what they say, so walk your talk. And be ethical. Be committed to holding a deeply held set of values. This too will instill trust in others. Strive to be highly competent. A nurse leader must have some core competence in his or her areas of responsibility. Show up on time, be at meetings, be there for people. Care about your staff. Nurses want to know that their leaders care about them as people, and be other-focused, not self-focused. Staff pay attention to the language you use, and leaders who are self-focused care more about themselves. Don't make things about you. Leaders who ask for feedback also demonstrate vulnerability and acknowledge that they're also on a journey. We've talked a lot about authentic leadership, and it has been determined that trust can be achieved by authentic leaders when they are transparent and consistent toward their followers. Characteristics of authentic leaders include self-awareness, active listening skills, empathy, humility, an internal code of ethics, emotional control, a relationship-centered approach, and high accountability. So be yourself, as Oscar Wilde says. Everyone else is taken. As our healthcare system changes at an accelerated pace, it is imperative that effective relationships are built between leaders and frontline staff. Building trusting relationships requires communication that is collaborative. Your role here is to create a safe space. Provide sessions for listening to others. Make sure others are able to speak and share frustrations. Encourage self-reflection in your staff. Respect confidences. Try to establish work group norms and agreements within the team. Invite diverse opinions, that constructive conflict. Be empathic. Model integrity and encourage creativity and inclusion. How teams work together is best highlighted in this wonderful video of the art of teamwork, learning from the geese. Nurse managers have an opportunity to support individuals on the team to utilize effective conflict resolution, involve staff in decision-making, and lobby resources for safe quality care provision. By doing so, positive practice environments and unit effectiveness will be enhanced.